I remember being reluctant to go into inpatient care. It was a return visit. I was embarrassed. I thought, my gosh, I failed at this. And I got there, and the second day, the nurse asked me, "How is your depression on a scale of 1 to 10, with 10 being the worst?"
Mm.
And I said, "Well, it's a 7." And I said, "And yesterday it was a 6. I'm getting worse," I said. "I feel so badly." The nurse pulled up a chair and sat down and talked to me. But most important, she listened to me. She was there to give me my meds. That was her job that day.
Mm.
But she was also there to just, like everybody, to check to see how I was doing. In those 2 or 3 minutes, she reassured me that it would get better. Those kinds of things cause one to say, I need to access help. I need to get help. I need to trust the profession to do the right thing for me.
Hi, everyone. I'm Dr. Shafer, your host of Talks with Dr. Shafer. I'm a physician, a mom, a life coach, a musician, author, and I am passionate about using storytelling as a tool to help you reclaim and reframe your story and build your most beautiful future. I am so happy today to be joined by Dr. Mark Peterson. Dr. Mark Peterson is a retired school administrator. He is a mental health advocate, a former patient, and a speaker on that topic. And he has been so kind enough to share his time and his wisdom with us here today. Thank you so much for joining me.
Thank you. Thank you very much for the invitation.
Dr. Peterson, when was the first time in your life that you were diagnosed with mental health issues?
When I look back, I would say that I had behaviors, and I was personally aware of things going on in my life that probably at age 14, I was aware that I had some depression issues. At age 32, I was seen by a psychiatrist, and at that point in time, given medication and encouraged to participate in therapy. I don't know that an official diagnosis was made. Certainly, they would have had to do something to give me the medications, but that would have been the beginning. So that would have been 1983. So what's that? 41 years ago. Yeah. Now that diagnosis, as we've learned more, and as I've gotten older, uh, the diagnosis become more refined, and so I have three diagnoses that I have that have evolved over the transition. See, the transformation of the profession itself, the field, and my change as a human being to have those three diagnoses. The first one is a major depressive disorder. The second one is bipolar. That's a fairly recent diagnosis. Bipolar 1, non-depressive, and then general anxiety disorder, which is the third. Those are actually in rank order. They would be the bipolar 1, then the major depressive disorder, and then the general anxiety disorder. And of all my health issues, of every health issue I might have, those three are always at the top of the list.
Yeah, that's an excellent point. That's an excellent point because often we think about, unfortunately, in society, mental health as other and body as primary, right? I'm going to go for my annual checkup and I'm going to get all of these. I'm going to check my cholesterol, my blood pressure, my heart, my liver test, and everything. And this is other. But as you pointed out, it comes first. And if you don't deal with it, if you don't address it, these other things are going to suffer.
Yeah. As a matter of fact, if when I look at my hospital discharge orders, the emergency room, when I broke my ankle, it has diagnosed illnesses listed, and it says in rank order. And my broken ankle is not the top one. The top one is bipolar 1, major depressive disorder, and general anxiety disorder, and then it goes through the others. Whereas a broken ankle is going to be one of those.
Yeah,
it is the most important diagnosis. Is the most important diagnosis for the practitioners to be considering when taking care of me.
Yeah, absolutely. With regards to your mental health and also, potential medications,
Yeah.
because we know that certain medications, if they're added on, could wreak havoc with the medications you're already on. It's very
Yeah.
important to be open with anyone who's taking care of you in the medical field because you can have consequences if they don't have a full picture of medications you're
That's
on
right.
and
Yeah.
diagnoses you have.
Yeah.
Absolutely.
Yeah. That's right.
That's
It's
really
absolutely
important.
right.
One thing you mentioned was how your diagnoses have evolved over time. And I think it's really interesting. I'd love to know your relationship to your diagnoses and how they evolved and what having those diagnoses has done for you.
Well, I think when I was diagnosed with a major depressive disorder, that now is a severe mental illness. Um, it's there. It doesn't define me, but it is me. I will always
Mm,
have a major depressive disorder. I could get treated with some pretty radical treatments that could make it almost go away. But the chances of that are not likely that it will go away completely. The best I can do
mm,
is manage it. And to not succeed at that all the time is not to be failing.
mm,
So if I have it in remission for 7 months, and then I find myself back in a crisis setting again, there is nothing for which anyone should be disappointed here. But you hear that. You hear that from
mm,
patients in the hospital. They say, my family's disappointed that I've come back. Oh, good grief. My gosh, we wouldn't be
mm.
so disappointed if someone's kidney was starting to fail again. No, we'd have empathy.
So, as we mentioned at the top of the hour, you are a retired school administrator. How did that career segue into being a mental health advocate and speaker?
Well, let me back up to time while I was an administrator and serving
Mm,
unintentionally as a mental health advocate. Because
mm,
I have was diagnosed with major depressive disorder fairly early in my life, back in 1983. I have been participating in talk therapy and received medications all of that time. I was very open about that with colleagues, and as I became a supervisor of people, I would often have conversations in my office about a family member or someone, or they would seek me out, having heard me
mm,
share those things before. They would seek me out and ask me if I could identify someone or encourage their family member or give them language that they could use to help a family member take the step to getting some help. I learned that
mm,
even though sometimes I had supervisors who would criticize me for doing that and say that's not in our best interest, my feeling was as I had
mm,
seen enough people get help because of my openness that I was going to do it anyway. That I felt that
mhm,
my openness and my vulnerability led to a number of people being able to get the help that they need. I retired
mhm,
as a school administrator in 2016 and had been hospitalized several times since then, and realized as I shared those experiences not as openly, but certainly not not with any fear about sharing them,
mm,
that people were often surprised at the experiences that I had recently
mm,
in inpatient care. And so I thought maybe there's more to share here. And as I began
mm.
to talk to my practitioner friends and other friends, they said, Mark, there's a story to be told. So hence the title mental health advocate now is a more official thing rather than informal. Is there, and that's the answer to the question about how I transitioned.
So, you took those experiences, those life experiences, and you wanted to share them. And that's very vulnerable and generous of you. I'm sure
Yeah,
you've helped
thank you.
many people with that.
Yeah, thank
Yeah,
you. Thank
that's
you.
wonderful. So, looking back at what you shared about your experience when you were trying to connect with people who were coming to you with questions, concerns, or problems that they wanted advice on, and you had supervisors giving you not positive feedback on that, what was that experience like for you?
Well, it was unsettling because I was concerned that perhaps my openness could come back to bite me in
Mhm.
some way in an evaluation or a parent who was particularly or colleague for that matter who was particularly vocal about
Mm.
my sharing those things and not feeling that should happen, that they could put a lot of pressure on my supervisor and that creates some difficulty for me. But um, yeah, there were some disquieting moments, and there were times when I didn't want to share with some of my more recent experiences with people. Certainly, when I was hospitalized, I didn't want to be very open about that. And I still
Mm.
am cautious to a certain extent because, I mean, not everybody wants to hear all of that about you. But when the
Mm.
opportunity presented itself, I said, no, I'm going to go ahead and share. I think that my opportunity to be helping other people is greater than what I might be preserving as far as my career is concerned.
Yeah. And I wonder when you look back and you think of times in your life when maybe you didn't share, and you compare those times to times when you were vulnerable and you shared because you wanted to, because you were inspired to. How did that feel for you as an individual? What felt better and what was sustainable?
When a colleague would bring someone to me, someone and say, Mark, for want of a name, let's see, Frida here is struggling a bit, and I told her that you might want to visit with her about what it was like to go through treatment or therapy or get medication. And I'd say, sure, I'd be happy to talk to them. And I would see them then, maybe weeks later or a month later, and they would come back and say, I'm feeling so much better. I got in to see
Mm.
a doctor. They prescribed some medication. It's working. I'm in
Mm.
therapy, talk therapy. Um, I just feel so much better. And
Mm.
sometimes then the friend or the colleague would come back to me and say, they just look so much better. Thank you for sharing that. I mean, that can't help but reinforce the desire to be open and vulnerable with people about your illness.
Absolutely. I think we get to a point in our lives too where we come to understand the power of our stories.
Yeah.
And I recognize that there is no safety in silence and in hiding my story and pretending that my life is something and I am something that I am not. It is not a way to connect with people. It's
No,
very disconnecting.
that's right. That's right. Yeah. And putting some flesh around the advice that you're giving by sharing your own personal experience and your own journey certainly makes that more attractive to the person you're talking to as
Mm.
something they may want to do.
And give them permission to really lean into who they are when they resonate with someone else, when they see a likeness in someone
Yeah.
else, because unfortunately so many of us have been trained or encouraged to put on the facade, to
Yeah.
walk through life as if everything is perfect. And really, anytime you sit down, anytime you have the opportunity to talk to someone, you learn how imperfect their lives are every single time. I've never had a one on one conversation with someone and walked away from it thinking, gosh, their life is just absolutely perfect. That's not how it is. Instead, you connect with them and you say, goodness, my life, my struggles are mine, but we can connect. I can use them to connect with this person.
Yeah. Two comments there. I looked as a school administrator, I was very successful. And so I looked like I had all my stuff together, like someone who wouldn't need
Mm.
to have medication or wouldn't need to have therapy. When in fact, anybody can be having mental health, an illness uh, that stays with them regardless of their personal success or happiness. That can come in and ambush them from time to time, or require some
Mm.
ongoing efforts. That when they would look at me and say, "My gosh, he looks like he's got it together," and yet he's taking medicine, he's going to therapy. I became a bit of a model for someone who was willing to seek help. The other thing
Mm.
too is I can leverage my pain to others' benefit. That makes it a little easier to also accept your own the reality that you have a mental illness is when you realize that if I'm open and vulnerable with others, then my pain is leveraged to their benefit.
Mm-hmm. And does that help also to cope with the things that you're coping with?
Certainly, certainly, and it reinforces my reaching out for help when I need it. Just seeing the fact that there's a toolbox there with a lot of tools in it, and I can reach out,
Mm-hmm.
reach, grab one of those tools when I need it to move on.
That's wonderful. And that is so important when we think about mental health, when we think about our general health, when we think about our habits. You have to prove to yourself, you have to create little data points where you say, okay, I felt this way, I needed to do something, and I did it. Even if you do one thing and you prove to yourself, I did that one thing for myself, then you can build on that and build that habit. And so I think it's really beautiful how you discuss, I'm showing myself that I can reach out for help. And then that just proves to me the next time to use the tools that are available to me.
Yeah, exactly. And when it comes to inpatient care, you know the view that a lot of people have of a hospitalization for mental health reasons um, is the Hollywood view, which is not
Hmm.
certainly not anyone would want to spend time in a place like that. When in fact, even just as recently as the last 10 years, it has changed so much, and there's so much more caring places than they used to be.
Hmm.
That one should see that as one of the tools, just like medication or talk therapy or others. That inpatient treatment in a time of crisis may be exactly what you need, and that you shouldn't be afraid to seek
Mm-hmm.
that out.
Mm-hmm.
I mean, let a
That's
mental
where
health person identify if you need to be hospitalized, but don't be afraid to go put yourself in a position where that may be the recommendation.
Mhm. And even, someone like yourself, as you shared, as a school administrator, as someone in a high position, um, who, you mentioned about, have happiness in your life, you're still going to potentially have these times of crisis
Yeah,
and need to reach out.
yeah,
And it doesn't take away from all those other things that make up who you are. It's
no,
just standing beside it.
yeah, exactly. And the thing is that people say, well, if you were hospitalized, then you shouldn't have to go back. Well, I know people who have a chronic pain condition. We don't say to
Hmm.
them, well, you were there one time. Why are you going back? Or a kidney disease, when they go back for
Hmm.
dialysis, we don't see that as a failure, just the reality of
Yeah.
the disease. The same thing with this
Yeah.
patient care. A lot of people have returned to hospitalization. That's not a failure of anyone or of the system or of the treatment. It's a tool in the
Hmm.
box. Just because I used a screwdriver in the box one time doesn't mean I'm not going to go back and use it again.
Hmm. Exactly. It's about forming those habits, using your tools. Yes.
Yes, exactly. With the investment that's been made over the last 2 years in crisis intervention and crisis prevention, with the rollout of 988, with the increased staffing in all of those areas, mobile crisis teams, and so on, uh, there are just so many places to go in the time of life or death uh, fears that there's really no reason for a person not to seek out whatever help they need. And I think 988 is always a place to go when you're not sure what to do and you feel as though this is a crisis that needs immediate attention. Then call 988, get on the crisis line and talk to them. They have resources that they can share with you or even mobilize in your behalf.
Wow. Thank you so much for sharing that. And I really appreciate your perspective. I can tell you from the physician side of things, it is not uncommon to feel really deflated when you think about access to mental health services because we don't have enough boots on the ground, it feels often to help people.
Sure.
And so
Sure.
we can have somewhat of a pessimistic approach to it and a lot of concerns. And I really love that you're here saying there are these resources. You can use them. They are available to
Yeah.
you, and there's no reason not to. And I love that message
Yeah.
because I think often people receive a different message. And the
Yeah.
truth
Yeah.
is, things have evolved, and there are different ways to seek out help.
Yeah. And I mentioned inpatient care, and it is a real passionate area for me because of the shift in how that works. It's gone from an old medical model of what's done to you or for you to what's done with you. And there's
Mm-hmm.
been such a change in inpatient care that I think demystifying, taking the Jack Nicholson's Cuckoo's Nest, the Hollywood version, out of that image and putting in a kind, caring, healing place is something that is important to me.
Mm-hmm. Yes, absolutely. I think demystifying it and making it more realistic is really helpful for people because if they are on that journey where they really need that intensive
Yeah.
help, it's wonderful if they really understand and have this example. And that's why it's so wonderful that you advocate and you speak about your experiences because it does demystify it.
Yeah.
And then someone who might want to make that decision, but they are stuck in a mindset about it that is really it's expired, it's lost its relevancy. It's
That's
great
right.
to know that you're having a better experience now than you would have anticipated before.
Yeah, absolutely. Yeah, absolutely.
From a system standpoint, because I know with your background, systems are really important. How do we get people access? You talked about 988. Is there anything else from a system standpoint that you are advocating for in the mental health realm to get people connected to the services that they need?
Well, I think in the time of crisis, when you really fear, or you're fearing for yourself, or fear for a loved one or a family member, that or a friend, that they may be making decisions or planning for things that could cause them some personal harm, um, or even their life, that you get them as close to a treatment intervention as you can. Uh, 988, certainly you've got the talk option there. I think most states have mobile crisis teams now who will come to your home, mobilized by 988. They can be there within an hour to talk to you about your what you're going through, recommend resources. The emergency room is not a bad place to go. There are crisis workers in emergency departments who are there just for this purpose, to visit with people to determine how serious their issue is, and then get them connected to something that will help them get through the crisis that they're in. And that something could be hospitalization.
Mm-hmm.
I remember the first time that I was told that they would recommend that I be admitted to the hospital. I said, admitted to the hospital? I said, what, a psychiatric unit? She said, yeah, yeah. I said, what if I don't want to go? She said, well, and then I got the message. I said, so you're saying I can stay or I can stay? And she said, yeah, that's what I'm saying. I said, well, what if I just stayed then? And I did. Uh, it's important. It's important that we recognize that don't be afraid of the emergency room. There are also
Mm.
have popped up here in the last several years all over the country, uh, mental health emergency rooms connected to hospitals or standalone. And your
Mm-hmm.
crisis workers on the 988 can tell you where they are. So if you're afraid to go to the emergency room, there may be another option there that gets you in touch with people right away to keep you safe. I
That's
can't
wonderful.
overstate the importance of not delaying action. If you feel you're in danger
Yeah.
or someone else is in danger, do something. Talking about it does not make it worse. If you ask somebody, are you considering committing suicide? Are you considering taking your life? Are you considering self harm? That's not going to trigger them to do it. If anything, it's going to allow you to intervene and do some prevention.
How do you feel when you look back at those moments of crisis and how you interacted with loved ones, with people in your life that were close to you?
Well, now I know when you're
Yeah.
hospitalized, there will be someone, crisis worker typically, who's assigned to you to help connect with family, to have the
Mm.
conversations, to help you be connected when you go home, so that you've got a
Mm-hmm.
safety plan, that you have connections to therapists, to make sure that you don't have the means available to you to take your life. They'll reach out to
Yeah.
family members and start to build that bridge for the two of you to meet together to have the safety that you need
Mm-hmm.
to move on. That's a tough
Yeah.
one, and I think uh, although I tell you, I've been in and hospitalized. And I watch people come in who are new and they're tired and they're embarrassed, and their families come to visit them, and the look on the family member's face is, "Thank God I don't have to worry about you tonight. You're safe." And
Mm-hmm.
that realization sometimes can be enough for them to say, "This was the right thing to do. This was the right thing to do."
Because sometimes that shame, it lives up here, but it's not necessarily something that your family is actually thinking, right? They don't want to shame you. They really want to encourage you to keep going on the path of healing.
Yeah.
But sometimes our negative limiting beliefs are telling us, people are thinking about us negatively. They're seeing a certain way, when in reality, they're proud of us and they're just happy that we're
Yeah.
safe.
Yeah. Yeah. Mostly,
Yeah.
I would say that's true. Families are
Yeah.
complex things. Some families
Mm-hmm.
never do get on board.
Yeah.
But but you got to take care of self. You have to take care of yourself, and
Mm-hmm.
you have to take care of your friends,
Mm-hmm.
and so you do what you need to do.
How can we empower the people that we have in our lives to feel encouraged and safe to seek out mental health services when they need them?
Well, one of them, and I'm not, is you get them to listen to your podcast is one way to do it. There are podcasts
Hmm.
out there, and there are people out there who have a clarion voice, and there are people listening. And I think that when we find someone like yourself that has that storytelling element, that encouraging them to listen, to hear the encouragement in the voice of someone who has that experience, to listen to the professional who's talking about it from a practitioner perspective. I think that I might want to do that, uh, to get them to call the crisis line, to help them take that first step, uh, to get informed, to recognize the fact that they do not need to live to continue. They do not need to continue to live with psychological pain.
And they need to feel safe to ask for help. Yeah.
Absolutely. Yeah, absolutely.
Yeah. And that's something that, I struggle with as a physician, the space, creating a safe space for people and the really short encounters that we have with
Yeah,
patients. Because you've got a list this long of questions to get through that aren't even the reason that the patient came to see you,
right,
but they're
right.
so important.
Yes,
And if someone mentions to you that they're thinking of harming themselves, full stop, everything else can wait, because they may
yeah,
not be
yeah,
here tomorrow to deal with their seizures or their headaches if we don't address this issue. And you want to just create this safe space where they know they'll receive help if they ask for it, but also where they feel safe to even share that when asked.
exactly. Yeah, yeah,
Yeah.
exactly. Yeah, yeah. It's you just have to stay with people. You got to the severity of the situation cannot be minimized. You've got to stay with people and do what you can to get them to seek help. Uh, and then that's all you can do. Once you reach that point, that's all you can do.
Yeah. And I love how you highlighted how when you were getting checked in to receive your crisis level mental health services, how the person you're working with tried to really respect your autonomy, and
Uh-huh.
they wanted to help you make that as your choice. They didn't
Yeah,
say, "You're coming with us."
yeah, exactly, exactly.
Yeah.
Even though at the end of the day, that would have been what would have happened because I was not safe. Yeah, I was not safe, and uh, for the time at that moment in time until they felt I was safe enough to go home, I was definitely safe.
It's interesting though, because I think, I question, would someone feel safe if they said, "Well, you're coming with us, you have to." Even though we're saying we want to help you, if it's in a
Yeah,
forceful manner, us as, neurologically wired creatures, that's going to trigger fight or flight in many people.
Absolutely.
That's going to trigger resistance versus, I think it's really beautiful and supportive the way it was phrased to you,
Yeah.
that it was your choice,
Yes.
even though there wasn't really a different outcome that could happen. They wanted to make sure you understood that you could choose safety and that they were there to support you, not that they were there
Yes.
to take away your autonomy.
Exactly. Absolutely. Yeah.
Yeah.
Yeah. The more inviting the place can be, the better off. Uh,
Hmm.
I have experiences within inpatient care that are so powerful. Simple interactions with nurses and others that if people realize how supportive that environment is currently, they just wouldn't hesitate for a minute to get somebody themselves or somebody else there to feel that element of safety.
And I think you're doing such important work advocating for that and sharing your experience so that people understand that it is a safe space and they can step away from the stigma and just get the help they need.
Yeah, that's right.
So, what is next for you on this journey of advocating for mental health?
Well, I have spent some time working on a speech, not necessarily a TED talk, but kind of like a TED talk to deliver to audiences, general audiences about inpatient care. And um, I'd like to be able to give that speech as many places as I can. Um, so uh, I think certainly sharing in your podcast and other environments is important to me. Getting in front of an audience of size or an audience of people who genuinely want to hear the message would be important to me.
Well, it's a powerful and important message, and I'm so glad that you came on Talk
Thank
with
you.
Dr. Shafer to share it. I really appreciate you.
Thank you. Thank you very much, Dr. Shafer.
Thank you so much, Dr. Peterson, for being with us today on Talks with Dr. Shafer. I'm Dr. Shafer, your host. It was such a pleasure to be able to speak with you, and I am
You.
so grateful for the advocacy that you are providing for patients who are coping with and families that are supporting patients who are coping with mental health challenges. These are challenges, yes. Are they insurmountable? No. Help is available. Dr. Peterson mentioned 988 today. And I sincerely hope that you will use this resource as well as your local medical resources to stay safe and to keep reaching forward towards the beautiful future that awaits you. We're so glad you're here. Take care
Thank
and
you.
stay safe. I'll talk to you soon.